Hi, this is Repeatable by Trustmakers. As is our way, today we'll be talking about a research study dealing with trust in communications. To introduce today's study is Ash Prasad, who reviewed the paper and prepared the summary.
Hi, today's study is called Health Canada, Framing During the COVID-19 Vaccine Rollout, Effective or Not, by Vukasovic et al. It was published in the Canadian Journal of Communication in 2024.
In the interest of full disclosure, it is important to point out that Health Canada and the Public Health Agency of Canada have been long-term clients of our company. While there are limitations to this study, there is for us here one key takeaway. Addressing vaccine mistrust is something that all governmental, medical, and health authorities could have done better. What we have seen is that people who are vaccine hesitant or resistant do not trust science, governments, and/or large pharmaceutical companies. This lack of trust means that the data, the information, the research, the historical evidence, and any other rational information brought forward by these parties may not be getting through. As we have said in other places, trust is a prerequisite and a result of open communication. In short, it is not a rational argument to be won. It is a subject for discussion that should focus on shared values and openly dealing with the risks as well as the rewards. This is something we feel a lot of leaders, experts, and PR professionals get wrong. It is not about trying to change behavior through facts and persuasion. It is about hearing and discussing. It is about finding out what is driving the mistrust and discussing it realistically, recognizing the limitations and risks of your own outlook. It is the difference between looking at a group as misguided and misinformed people under the influence of social media trolls and seeing them as people with concerns that are worth discussing and understanding. With increasing outbreaks of diseases such as measles, and the fact that the U.S. has appointed a health secretary with, shall we say, a limited understanding of science and how it works, we all need to recognize that the question of vaccine hesitancy and resistance is a trust issue that goes beyond solely putting out factual information. Thanks, Ash.
Great.